This House do now adjourn. Steve Brine.
Thank you very much, Mr. Deputy Speaker. Earlier this year, it was announced that Wales is set to become the first UK nation to introduce mandatory national licensing for what we call special procedures. That'd be tattoo artists, those working in body piercing, semi-permanent makeup, acupuncture and electrolysis. The licensing regime in Wales is being introduced under Part 4 of the country's Public Health Act of 2017. Happily, Section 180 of the Health and Care Act 2022, passed by this place, gave the Secretary of State the power to introduce a licensing regime in England. And I'm really glad we're now doing the same, and our government is taking this issue seriously. This evening, Mr. Deputy Speaker, in this very short debate, I'm keen to hear from the Minister what the government is doing to speed up the introduction of this regime in England, something the Health Select Committee, which I chair, of course, called for when it published a report on the issue of body image back in 2022. And I just would like to mention my honourable friend, the member for Bosworth, and my right honourable friend, the member for Sevenoaks, who did good work in this regard when they were on that committee. Now, as we are all well aware, non-surgical cosmetic procedures such as Botox, dermal fillers, chemical peels, and aesthetic procedures such as tattooing, body piercing, amongst others, are soaring in popularity. The beauty industry is valued at an estimated £3.6 billion in the UK, and this boom has been fuelled by sales on social media and in beauty shops on the high street. These procedures, while popular, carry risks that I think must be managed so that we protect both those who undergo the procedures, but also those who provide them. At present, healthcare professionals such as doctors, nurses and dentists who carry out non-surgical cosmetic procedures must be trained and insured as part of the requirements laid down by their own regulatory bodies or royal colleges. But there is no set training for beauty therapists and other non-professionals, which is a cause for concern and an issue many respected practitioners have campaigned about for some time. It is, after all, in their interests. As the sector has boomed, there has been a rise in people being physically and mentally harmed from poorly performed procedures. The aesthetic sector has been described to us by some, in part, as the Wild West, which clearly isn't ideal for anyone, patient or practitioner. Further to this, a survey carried out by the British Association of Aesthetic Plastic Surgeons found that 69% of its surgeons have seen patients with complications following temporary fillers. Again, I would say outlining the need for the licensing scheme to be introduced and enforced. An estimated 900,000 Botox injections are carried out in the UK each year, with 3,000 complaints registered in 2022. I would say the public need to be educated on the risks and cannot assume someone is trained if they're carrying out an aesthetic treatment. It goes without saying you should take the time to find a reputable, insured and qualified practitioner if you decide this is for you. To my mind, Mr. Deputy Speaker, the licensing scheme is an important step towards better outcomes for the industry and consumers to hopefully remove rogue practitioners from the industry. Practitioners must have adequate training to deal with complications and minimise them in the first place. For instance, a blood vessel blocked while undergoing a procedure could easily block a patient's blood supply to their eye. I was contacted with a horror story of one woman not being able to open her eyes for 16 weeks following Botox treatment. Now, Wales opened its 12-week consultation on its licensing scheme in January of this year, with a scheme aiming to reduce infections, eliminate poor working practices, and create a central public register for licensed practitioners and approved business premises. This is important as the industry continues, as I say, to increase in popularity. The Welsh Chief Medical Officer said at the time that he is very pleased these impending changes have been widely welcomed by practitioners across the country, with many actually already volunteering to meet the new standards themselves. One tattoo shop owner who's been working with the Welsh Government on the new qualifications said, it was widely reported, the increase in quality of tattoos in the last decade has been exponential, so the hygiene needs to be raised. This is all positive for the industry and helps shape the image of it being dark and shady. It's reassuring for those getting tattooed as well. I obviously very much agree with that statement, which shows why we need further legislation or regulation off the back of legislation in England to protect both clients and practitioners. In answer to a written question earlier this month, the Welsh Government confirmed that the aim is for their statutory licensing scheme to come into force in the summer of 2024, when it will initially apply to the 4 special procedures specified in their 2017 Act, so electrolysis, body piercing, tattooing and acupuncture. As I say, I was pleased when the Health and Care Act 2022 introduced powers for the Secretary of State to establish a mandatory licensing scheme in England, following the calls for greater regulation of non-surgical cosmetic treatments, not least from my select committee. But I'd say it's important, Minister, that the scheme is introduced sooner rather than later, something we emphasised in our body image report. It was positive when the consultation in England finally opened at the beginning of September this year, with pretty much the same intentions as the Welsh piece of work. However, concerns have been raised with me by those in the industry that the consultation in England has been far too heavily based towards medical input rather than those in the cosmetics industry, which make up a large part of the sector. As part of our body image inquiry in 2022, the Health and Social Care Committee recommended that the introduction of a licensing of non-surgical cosmetic procedures was made a priority and introduced by July of this year. The committee also suggested a safety task force was set up to bring stakeholders together, but the government, I understand, decided not to follow this route. The NHBF, the National Hair and Beauty Federation, say they are concerned that the government have not reached out to a broad enough range of stakeholders, and I'd like to ask why the government didn't pursue the route recommended by the Select Committee. In the pre-consultation phase, it was felt that more medical than beauty organisations were consulted, which the NHBF has suggested caused a bias towards the medical sector. I think this is creating concern, Mr Deputy Speaker, that routes into aesthetics via the beauty sector will therefore be restricted, which will have obvious consequences for many legitimate and reputable businesses. This also creates a risk that the new regulatory regime may drive some practices underground into that market rather than increase the quality and standards across the industry, which is what we're aiming to see. The NHBF also said in September that they had written to the government twice this year regarding the new licensing scheme, but were yet to receive a response. Maybe that has been updated since. When implementing mandatory licensing, we need to make sure we're establishing a framework that demands a higher standard of care and proficiency from all practitioners. Further to this, another issue I think needs to be addressed by the national scheme is procedures carried out in tattoo and piercing studios in England, which are currently subject to regulation by local councils. But due to there not being a national scheme, it means that we currently lack the reassurance needed. Practitioners need to contact their local council where their premises are based to get a tattoo, piercing or electrolysis licence. They must then register both themselves and the premises with the local council. However, registration is a fairly simple process and there's no requirement for the provision of proof of qualifications. Local authorities also have few powers to refuse a registration. The current licence with local authorities covers tattooing, semi-permanent skin colouring, cosmetic piercing, electrolysis and acupuncture. Local councils do, it must be said, conduct regular inspections of premises to ensure that they're compliant with health and safety laws, and that is a requirement for every tattoo artist to be licensed by their local council. Tattooing without a licence or tattoo certificate, just remind the House, is illegal. However, the fact that licensing is determined by local councils in England means it differs on what standards must be met across the country by those who apply. For example, some councils demand that all practitioners have access to their own sink, while others are happy for shared sinks, which risks cross-contamination, posing a health risk. A new compulsory licensing scheme, I would contest, will ensure that both clients and practitioners are adequately protected, and practitioners would have to abide by the same rules across England. The purpose of registration with councils is to protect members of the public from the transmission of blood-borne viruses such as HIV, hepatitis B, hep C, and other infections, and to ensure that the health and safety regulations are followed. And I think a national licensing scheme would increase this. As I've already set out, while Section 180 of the Health and Care Act enables the Secretary of State to establish a licensing scheme, this is yet to be fully enacted. The consultation process closed a month ago today, and the advances to implement this hugely important scheme have been slow in England prior to this. So I must ask the Minister, when does she think the government will be responding to the consultation? There are 4 key priorities that must be addressed in the new licence scheme to make sure there is adequate protection for practitioners and clients. Firstly, the design and implementation of the national licensing scheme for all premises, as well as practitioners of non-surgical cosmetic procedures, to ensure that those who practice invasive procedures are competent and safe for members of the public, our constituents. Secondly, all practitioners must hold the correct insurance to provide those procedures. Thirdly, there needs to be official guidance on the training and qualification expectation of all practitioners, such as the knowledge and application of infection controls and first aid training should things go wrong. And finally, a system we need that effectively records adverse incidents and public awareness raising so that all cases that go wrong can be tracked. I think this system would dramatically improve safety standards. It would also ensure members of the public are better equipped themselves, as they would have better tools and knowledge surrounding the procedures and the practitioner that they were using. The government did assure the Joint Council for Cosmetic Practitioners, the British Beauty Council and the Chartered Institute for Environmental Health that it was committed to the licensing of non-surgical aesthetics sector in England. So I'd just like to ask the Minister in closing when we may expect to see further action on this following the consultation that I've mentioned. Yes, just before I close.
Can I commend the Honourable Gentleman for Winchester for bringing this forward? And back in my council, Arden Northdown Borough Council have a policy in relation to piercings specifically. Council have initiated a piercings guideline policy to make both piercers but also those who get piercings aware of the guidelines and policies and their words that must be followed. Does the Honourable Member agree that there could possibly be more discussion of improving this information in local schools, for example, so as many people who get piercings are under 18 years of age, often naive to the guidelines and hygiene policies that piercers must follow? Educate them early. Would that be the Honourable Gentleman agree to that?
We have enough debates in this House about some of the things that we teach in schools, and I can only but imagine some of the response we would get to this. But education can never be a bad thing, in my view. There is nothing wrong with tattooing and piercings. It isn't personally my choice. I don't know about the Honourable Gentleman for Strangford, but if you're going to do it, I think you should go with your eyes or any other part of yourself wide open, and that's why I think his point is well made on education. That'll amuse you, Mr. Deputy Speaker. So just in closing, would it be possible for the Minister to outline the timeline, even in rough terms, for the licensing scheme being introduced? And finally, and I understand that it's complicated and it's a bit like peeling an onion, the more you take, the more you find. Could the government outline what procedures will fall under the new licensing scheme? And on that I will close and say I look forward to hearing from the Minister. Thank you.
Minister, Maria Caulfield.
Thank you, Mr Deputy Speaker. Can I start by congratulating the Honourable Member for Winchester for securing this important debate and to reiterate to him the Government's commitment to improving patient safety in this area. And we recognise that there has been for some time concerns around the lack of regulation both here and abroad and the dangers these can pose to consumers and the long-term impact when these go wrong. And as he pointed out, but we've heard many horrific stories over time, both in this place and in Westminster Hall, of what can go wrong when these procedures are either done poorly or some of the side effects that consumers or patients were not expecting. There are, I will touch on in a moment, but there are existing regulations for body piercing and tattooing, as the Honourable Member for Winchester pointed out. But in the Health and Care Act, we did take this so seriously that the Act gives the Secretary of State powers to introduce a licensing scheme for non-surgical cosmetic procedures in England. And the scheme we intend to introduce in England will be more extensive than the Welsh scheme that the Honourable Member touches on. It will cover more than the 4 areas outlined in their recent piece of work. And what we're doing at the moment is, obviously we've just held our consultation, but looking to see whether that will also cover some of the existing powers around tattoos and piercings that are enforced by local councils. Now, what we want from the scheme that we intend to introduce is to support people to make an informed choice, and that when they make their choice, that they are experience safe care for any non-surgical cosmetic procedure. And the 3 areas that we really want this licensing scheme to address is that those services are administered by suitably trained and qualified practitioners. Now, that doesn't necessarily mean regulated healthcare professionals, but it does mean that anyone that undertakes them is trained and qualified to do so. We also want them to hold appropriate indemnity cover, so should something go wrong, that they and the patients they are treating are covered. And thirdly, that they are operating from premises which are appropriate in terms of standards of hygiene and cleanliness. So, as my honourable friend has said, we have been working closely with many professionals from a variety of backgrounds to start the process of introducing this licensing scheme. And the cosmetic procedure sector includes a vast range of expanding treatments and techniques. And one of the things we want to do is to future-proof this regulation so that we cover as many emerging techniques and treatments and procedures as possible, so that we're not constantly having to revise this on a regular basis, and covering a wide range of practitioners and businesses. And we want these businesses to thrive. These businesses contribute to our economy and provide a very popular service, but we need to make sure that they're safe and well regulated, so that those undergoing these procedures can be safe and are making informed choices about the treatments that they get done. However, we do need to make sure that introducing this licensing scheme, that we consider all eventualities, and there are a number of factors to consider, from who undertakes these procedures to the types of procedures that are covered, and also the range of who undertakes the inspections and regulations once these are introduced. Now, through our engagement, we've developed proposals on which treatments to be included, who should be permitted to introduce, to perform them, and also age restrictions, and whether these need to be introduced for certain procedures as well. Now, we did roll out our initial consultation, as my honourable friend from Winchester said, which closed at the end of last month. We received over 12,000 responses, which is a pretty significant amount of responses from across England to a government consultation. We don't normally get as high a number as that. And just to reassure him, 43% of those were from aesthetic practitioners, and joining up the various regulated health professionals, they were about 40%. So there was an even mix between those who are practitioners as opposed to regulated healthcare professionals. So we have got a fair balance of views through that consultation. And we are working at speed now to work through those responses. And I just want to thank everyone who did respond, because it really will inform how these regulations go forward. And in the next 12 months, we are going to be working through the responses and then setting out exactly which procedures will be covered by the regulations, education and training standards, requirements for those who will be practicing these procedures, the types of premises that will be allowed, the types of licence fees that will be introduced, if any, and who will then enforce these regulations to ensure that that they are complied with. That will take time, and we estimate that will take most of next year to do. So, but I can assure him that it's absolutely crucial. I thought, like him, that we'd be able to get this done pretty swiftly. But once you start to unearth which procedures should be covered, who should be doing them, and the types of premises they should be operating from, actually it's a can of worms, and it's really important that we take the time to get this right so that we have a really robust, extensive and safe regulation licensing scheme in operation across England. Now, he did touch on tattoos and piercings, and as he said, there are schemes for those which cover regulations around those, such as the Local Government Miscellaneous Provisions Act of 1982 and the Local Government Act of 2003, specific to geographic areas of England. And these existing legislations give local authorities the power to register practitioners and their premises and to enforce bylaws. So if they're not abiding by those bylaws, that their enforcement action can be and does take. And he is right, though, that varies across England. But the measures that they do undertake do reduce the risks of transmission from bloodborne viruses such as HIV and Hep B and C. And the department does have a model bylaw template. So if local authorities want to introduce it in their local area, they can contact us for that so that we try and get it as consistent as possible. We are looking at whether those regulations for tattoos and piercing should also come under the non-surgical cosmetic regulations, and we are engaging with those sectors to see whether we have one wide piece of legislation and regulation around that, or whether we do have a dual system, because many of the tattoos and piercings practitioners feel that works quite well for them right now. So we haven't ruled that out, but it's important to note that as it stands, there are already regulations around tattoos and piercings that should be being enforced by local authorities up and down the country. I just want to touch on cosmetic procedures abroad, because this is becoming more of a topical issue as costs rise and sometimes these procedures are often cheaper abroad. It is so important that we make sure that people from the UK travelling for these non-surgical cosmetic procedures again are informed about the risks and do their research before they travel. And while excellent healthcare is available internationally, we will also be aware of tragic cases, even where people have lost their lives by having treatments outside of the UK. The team are actively engaging with international partners to consider how best we can support people considering travelling abroad for these treatments, and having a safer regulated system in England will help inform people that if they're travelling abroad, they should be to the same standard as the licensing scheme that we are intending to introduce in England. So for my honourable friend, I absolutely understand his urgency in wanting to see this licensing scheme come forward. That's why we introduced it in the Health and Social Care Act. But it is a complex area. We need to decide who will be undertaking these procedures, which procedures they will cover, and future-proof it so that we are covering as many as possible. And also look at the premises that they're operating from, who the regulator will be. Would it be the CQC? Would it be local government? Would it be regulators like the NMC, GMC, who all have a role to play in this? So there is a lot to decide before the legislation and the regulations come before us. I can assure him we will be working to respond to the consultation early in the new year, then setting out what the framework of what the legislation will look like. We will do a further consultation on that before we finally announce it, because as he said, there are concerns across the sector. There will also be an interim period where, if we are introducing mandatory training for practitioners, that there will be times for those who are operating in this space to take on those qualifications and training, or to upgrade their premises, or to look at which procedures they are undertaking, because we want to ensure that those who can practice safely have the time to be able to develop those skills and upgrade their premises accordingly. So I can assure him we will consult on that again, so people will be fully aware of the changes coming through. But I look forward to working with him and his select committee to make sure that we have an extensive regulation scheme across England as quickly as possible, but one that is robust and meets the needs of patients, most importantly, but the sector as well.
The question is that this